Dissociative identity disorder is indicated by a person switching to an alternate identity. This person can be aware of two or more characters living within their heads, each one having their own thoughts, feelings, personalities, mannerisms, medical needs, genders, knowledge, and so much more. But the person can also be completely unaware of their dissociative identities. The alters can communicate with each other and generally have the shared goal of protecting the owner of the body. Dissociative identity disorder is usually brought on by severe childhood abuse or trauma, whether it be physical, sexual, or emotional. It becomes a coping strategy in situations where the owner of the body cannot withstand the suffering that their body is being put through and allows an alter to come out and handle the situation for them. DID is typically more common in females and children, but can develop at any age. Dissociative disorders are not a genetic condition, though some people can biologically be more prone to dissociating. Generally, it occurs in children who lack support at home or are growing up in a toxic environment. Next, I'd like to introduce you to Jess. Jess is a 19-year-old girl living in California, and she has been diagnosed with PTSD, DID, major depressive disorder, and social anxiety disorder. She has been in and out of hospitals since she was 4 years old, and the next clip shows Jess dissociating and Alex, her alter, coming forward.
Um, each of us has a different room, and when we're not out, we're usually in our room, just kind of chilling and doing whatever we want. And you know, Alex likes to dress up, and like play doll or whatever inside her room. Max likes to read books and look up videos on. Um, Max likes to read books on physics and watch videos on multi-dimensions or whatever. Uh, um, Hi YouTube! Oh my gosh! Just started to film! I was so afraid that she was not going to allow me to do this, but I started this YouTube channel and I'm so excited. Max and I, oh, sorry. Hi, my name is Alex. I forgot to introduce myself. I'm so excited to meet you all. And if you have any questions, just comment down below and maybe we can make another video or maybe we can do a Q&A or something about this. But I love YouTube.
This video is a great example of DID presenting itself in everyday life. Even though dissociative identity disorder is developed to protect the host from harm, this video shows that once the alters are born, they can come out in any situation and become a part of normal everyday life. When communicating with someone with DID, it's important that you enter their reality. There is no cure for DID, and it will most likely be a part of this person's life forever. And for them, these identities are truly separate people and should be treated as such. Remember that conversations you had with one alter will be completely separate from the others. It's crucial that you respect the alters and that you be very aware of both your verbal and nonverbals because people with DID can be very aware and sensitive of emotions and their level of comfort with you. As a healthcare assistant, we can make sure that we get to know our clients, their different alters, and even learn what triggers which alter to come out. It's also very important that we adjust our care for whatever alter is out during that day and we respect their decisions during the process. The most effective form of treatment for people with DID is some form of therapy. These include psychotherapy, cognitive therapy, family or music therapy, and dialect behavior therapy. While there is no cure for DID, with ongoing help, the person is able to be a high functioning member of society and lead essentially a normal life. The alters are able to come together and work cohesively to achieve the host's goals and dreams. There are no medications to treat dissociative disorders specifically, but it can help to treat underlying causes or symptoms such as depression and anxiety. Psychotherapy is the most widely used form of treatment for dissociative identity disorder. Its main goal is to help rebuild relationships with families and friends and allow the patient to express their feelings in regards to the abuse or traumatic experience they had. Two pros of psychotherapy would be that it allows patients to deal with their traumatic experiences and move forwards, slowly rebuilding their trust and forgiveness. It also works towards fusing the fragments of the alters to rebuild a whole new person and keep the identity together. Cons of psychotherapy would be that if the sessions are not paced properly, patients can become very overwhelmed by anxiety and stress by the whole situation. It also risks flashbacks, which could cause them to relive their traumatic experiences and have to go through those strong and very difficult emotions again, possibly resulting in more harm than good. Dialect behavior therapy is a form of cognitive therapy that guides the patients into finding healthy ways to soothe themselves during negative emotions and to create crisis prevention techniques to cope with stressors. The pros of dialect behavior therapy are that it's designed to promote mindfulness and increase the patient's ability to deal with negative emotions. It also gives the patients the skills to communicate more effectively with those around them. Cons of dialect behavior therapy are that it can require a lot of participation and willingness on the part of the patient. Sometimes it also requires medication to be fully effective in some people. Boreal Wellness Center is located on Mainland Street in Vancouver, BC. It offers everything from day treatment, intensive evening outpatient treatment, and focuses on using a whole body approach to building awareness, resiliency, and has a core group of psychotherapy sessions that are focused on nutrition, fitness, mindfulness, sleep hygiene, relationships, and communication skills. The BC Borstal Association specializes in trauma and those whose life has been impacted by it. It has everything from one on one counseling to group support, education and training, cognitive behavioral therapy, and DBT therapy as well. What I think is really important is that the BC Borstal Association not only has a line where you can call and book an appointment with a counselor for any time, it also has a 24-hour crisis hotline for any time you need to speak to a counselor immediately.